The Latin American country of Venezuela, population 32 million, almost the population of Canada, lies right at the uppermost tip of Latin America, and it is at the moment in political and economic chaos. It is in fact in economic freefall. The inflation rate, believe it or not, is 14,000%, and there's been a 15% reduction in the overall economy in the last couple of years. And ever since a left-wing government was elected in 2014, it grieves me to say left-wing, the government has followed ever more perverse economic policies, ever more savage repression, unconstitutional behavior, anti-democratic behavior, more and more power to the military, food shortages right across the country. And of course, when the bottom dropped out of the oil prices, oil being the commodity on which Venezuela was dependent, the economy went to hell in the proverbial handbasket. But of course, the area that is most affected by all of this is human health. It is ever thus. So maternal mortality rates are skyrocketing, infant mortality rates are skyrocketing, rates of infection of HIV and tuberculosis are going up, rates of death of HIV and tuberculosis are going up. Thousands of doctors are leaving the country, 22,000 at last count. 79% of the hospitals have no water, and there are complete stockouts of antiretroviral drugs, of drugs to fight tuberculosis, of antibiotics, of laboratory equipment, of x-rays, even of condoms. It is a dreadful situation, and of course, as a result of the lack of drugs, people are dying. But it need not be so, because Venezuela isn't Syria or Yemen or Myanmar. Venezuela can be dealt with, and it can be dealt with because there is a route to get the drugs to the people who need them. And the route is through a nearby country called Panama, which is the headquarters of the Pan American Health Organization called PAHO, and where there is a United Nations humanitarian depot. And if the drugs or the money is supplied to either of those places, they can be picked up, the drugs that is, by a remarkably sophisticated, intelligent, principled network of civil society activists who take the drugs through Colombia, the country adjacent to Venezuela, and into Venezuela, and manage to give them to the people who are dependent and desperately need the drugs to stay alive. Now recently, 4,000 boxes of drugs came to Panama, and the drugs in those boxes managed to service 30,000 people for 2 months at a cost of $3 million. Obviously, then, if the money of reasonable amounts could get into Panama, we could have a route of drugs which would keep people alive. But the money isn't there. So where is the Western world? Where are the rich Western countries giving more than a few $1 million, which is the case of Canada and the United States? By the way, the volatile political behavior of the United States, as you can guess, is not helping Venezuela. But where is the money from the wealthy Western countries? And if I may be so bold, there is something called the Global Fund on AIDS, Tuberculosis, and Malaria, whose entire rationale exists to deal with infectious outbreaks of this kind, and yet they have not been able to pull themselves together to deal with Venezuela. It is as though the Global Fund suffers from some kind of cerebral palsy. Excuse me for being agitated, but there have to be ways of overcoming the so-called eligibility requirements which prevent Venezuela from getting the drugs. You know, there was a doctor quoted in a recent article on Venezuela that really struck me, a very evocative quote. He used the phrase moral rupture. There is a moral rupture in the government of Venezuela. There's a moral rupture amongst the Western countries of wealth. There is a moral rupture at the Global Fund because people should not be dying. As a matter of fact, these eligibility requirements of the Global Fund amount to eligibility for death. That was last week. I'm Stephen Lewis.